heard from Naudi Aguilar, which is from over at Functional Patterns, which I've done a couple courses with him. Great stuff. I've been doing a lot of rotational exercises through his channel. But what I was talking about was his concept of, which is actually Thomas Myers from Anatomy Trains' concept of being fixated in a certain direction. I was just kind of explaining that earlier. I think when we're talking about those shoulders coming forward, that these pec muscles are actually tight, which is true. These pec muscles come closer and they become tighter. And these back muscles, like I explained with this blue band, is actually taut, right? So when that happens, this whole area is fixated in a specific direction. Now, it's not the fact that it's a bad thing. You know, a lot of us as therapists, and a lot of us as even as clients, we look at things as such negative connotations. As we put, like, let's say bad posture, and we say, "Ooh, this is bad. We need to fix this." So right away, the brain registers that as something negative. So negativity breeds negativity. Negativity breeds negativity. It's not in the direction of healing, and it's not going to help you mentally kind of get over these patterns of dysfunction. You can call them dysfunction. So it's your body's adaptation to a behavior, movement, anything like that. So it's actually a good thing. So the way we can look at it as therapists is like, wow, the body's so incredible that it's laying down collagen, laying down fascia to help you in those positions. However, it does change from there. It actually gets to a point where, you know, this is where people end up with numbness in their three fingers. They end up with numbness in certain parts of their arms. If they're constantly doing shoulder shrugs, like I know a guy that does that, they're dealing with a lot of neck issues and a lot of radicular kind of nerve pain. And it's not to say that those activities are bad. It's just a matter of being aware of what muscles are being hyper focused on and what muscles are being left out. Okay, so in talking about the shoulder and then talking about all that, I really want to stress the fact that those muscles in the back are taut, but remember, because these are so tight, what do we do for these structures? How do we get to the point where we can fix this instead of just getting a massage to the muscles that are already stretched out, which we talked about earlier? So we're massaging muscles that are already stretched out, which is furthering the stretch. And then some therapists, I know a lot of therapists don't even treat the pecs. And a lot of clients don't even know that the pecs should be treated. I'm not talking about the breasts, I'm talking about the chest. There's a difference. In the chest, you can just treat up here. As a therapist, if you're ever worried about all that kind of stuff, just find draping. You know what draping is. Drape down to where the lower part of the collar is and work on that upper insertion part, because I'm telling you, if you're not as a therapist, we are lost, especially with people with hyperkyphosis. Okay? Hyperkyphosis is just the meaning of that basic posture, okay? Now, when that happens, and we talked about the pecs being tight, pulling forward, that being weak, pulling weakness, then you end up with all of this. Just, not only is it gripping, but it's also getting condensed and compressed, and everything is pushing forward, and then we're asking why our neck hurts. I mean, once you start understanding a little bit of why that's happening, you can start thinking of easier solutions than just Tylenol, Advil, and all these kind of things for your headaches, right? Now, what I really want to talk about that is something super important. Stretching versus stimulating. Really, really important. I think a lot of us as therapists really focus on the concept of stretching, and we give clients stretches and we say, yeah, stretch this out when it hurts. I would like to address that we should be doing the opposite. We should all be giving people exercises and little tweaks that they can actually start strengthening areas. Strengthening is actually more important than loosening.
Strengthening is actually more important than loosening.
In a lot of cases, not in every case, but in a lot of cases, we need to actually strengthen areas. And that's why a lot of muscle pain happens in the first place. We'll get to the low back, but I really have a great example for low back, but for neck, it manifests as, like we talked about, neck issues. And that is simply lower trapezius, the muscle in this part right here. So around this area right here. Where would it be, Matthew? What do you think? Like T12 areas where actually lower trapezius is?
Yeah, it ends at T12.
So around T12 is where a lower trap. Now a lot of people don't even know how to activate that muscle or even where it is, and I'm talking about to therapists, but if you're a client, the lower trapezius is simply the lower part of the trap muscle. The trap muscle starts here, goes all the way in here, touches the shoulder blades, comes back, and all the way up through the neck. Now when we have an upper part of the upper traps, then we have mid trapezius, I'm going to be talking about this a lot, so try to follow that. And then lower trapezius. Lower trapezius helps bring everything back. So does mid trap. It helps the rhomboids and it helps everything pull back this way. Upper trap kind of stabilizes everything up in that direction as well. And all the fibers go in different directions. However, they all work together in this symbiotic kind of push-pull, okay, what needs more adjustment? How do I help with that? How do I help with this type of movement? And the fascial connections between them all is actually amazing in terms of its technology. But if we're trap dominant, when I say upper trap dominant, that means people that are stuck here, people that are stuck here, people that think that if they do certain exercises and they stay up here, it makes them look bigger. And it does. It makes your neck look bigger. It makes your shoulders look bigger. But you end up with issues and you end up with pain. And like, yeah, the looks might be nice, but is it actually functional? Is it usable? Right? So if you're upper trap dominant, usually this muscle works as like a tension. Thomas Myers talks about tensegrity. Tensegrity being, for example, like if this was something that was working together as one function, like a soccer net, for example. If a soccer net has this side pulling on it, and it's pulling, it's all obviously going to start pulling on the other corner, right? So in order for me to change the pull that's happening on this corner, I would have to like either pull this corner back, or pull that corner of the net, or pull this corner of the net to create this actual balance in the soccer net. And this is where no pain happens. Why would there be pain in a body that is actually fully balanced? And you're never going to be fully balanced, but you can at least be relatively compared to something where all the tension is being built on one corner and all the rest are just being kind of tugged on. And that's what you see when you have upper trap dominance. It's the exact explanation of upper trap dominance. So this is perfect. I can put this, overlay it like that, right? And that's actually the kind of where the muscle actually really is, which is really nice. Now, if I have upper trap dominance, look what happens to the band. It kind of comes up, pulls in, everything pulls up, everything pulls forward, and this all becomes tight, taut, and no wonder you have neck pain, soreness in this whole area, headaches because the fascia travels up through the skull as well. Okay, now to change that, what do? Do we sit here and stretch this? All right, you know, maybe 5 minutes to a day of relief, possibly. Not to guarantee about that, by the way, no guarantee. Do we try to stretch out the neck? Get treatments for the neck? Yeah, loosen up the tension right here. Look, this is me loosening up the tension in a hyperkyphosis. This is me loosening up tension. Ready? What happened to the rest of it? Nothing at all. Nothing at all happens to the rest of it. If anything, you're creating even worse tension because the body's like, oh no, the tension has decreased. Let me increase the tension. So it increases the tension even more. So it's like we're going backwards in a way. This is not for everybody. This is for like the chronic, just regular neck issues and neck pain. But this is really good information for everybody to really sink in, even for myself when I think about my own pain. So the real fix for this isn't to stretch this out and do all these treatments to this. It's to create stimulatory effects to this lower trapezius muscle and this mid trapezius muscle to create the tension to being, instead of being pulled from up here, it starts to pull it back down, which adversely is attached to everything, pulls the whole shoulder blade, pulls everything with it back that way. But then once you start pulling that, you'll notice a little bit of tightness. That's where massage therapists can come in. That's where that's where all your stretches can actually become a little bit more effective when you're doing it in the right spots. This can be stretched when you're trying to change the chemistry of how your body is moving. This can be stretched out for sure. This is what I treat all the time. I work on pecs. I do myofascial release to these pecs. I do under the scapula treatments. Like without doing scapula treatments as a therapist, we are relatively lost because that scapula is either winging off the rib cage or it's being glued on. So either one of those, you're going to need some sort of work underneath that rib cage, and it's really a sensitive area, but it's really underneath this belly. It's not something like in here, it's not on top. You have to really get inside that armpit. So what I do is I have this arm usually in this position, and I try to, the shorter you take that, the more deeper you can get in there. Now, one big disclaimer is do not go into the armpit itself. Probably a bad idea. There's a whole bunch of nerves that come in from the neck and they travel through that, and I've actually heard of a couple cases of people pushing into that and then ending up with like serious issues after. So it's not in the armpit. It's just lower to it. Okay, there is a distinction between that, so I've seen some people mistaken that. We have to stretch this, stimulate this, and once that happens, you end up with a normal shoulder positioning. Once that normal shoulder positioning happens, your neck is sitting perfectly, and there's no need for pain or dysfunction. Now remember, the head itself is around 10 pounds. Okay. Now, for every inch forward it moves, it's about 10 pounds added. So if I go like this, when I say 10 pounds added, I mean 10 pounds of force added to the spinal column. Okay. So when I bring this an inch forward, that's 20 pounds, 30 pounds, 40 pounds. And I've seen people, I can go outside right now and spot out 5 people standing on the street that are standing like this. This is completely normal for most people. And this is about 30 to 40% of tension and pain, tension and force shearing on this spine. If I could bend this, I would show you that these spinal columns become condensed. See how these pointy here? They actually end up touching each other and rubbing on each other and creating what we call facet joint, or some sort of irritation in that, which also irritates this, depending on if there's a rotation in there. You end up with a little bit of nerves getting like kind of pinched as well, and then you end up with like headache, arm, shoulder pain, and then you just end up with all these issues, and then where do you go from there? That's why therapists have full-time jobs, because it's like, I can keep treating 100,000 different things on your body for the next 10 years if you never change the way that your body is fixated, the way that your body is actually positioned, right? And it's all about how it's standing and how it's sitting. So it's super important to get things in alignment. That's where there will be no pain, okay? So don't forget, we got pec major, pec minor. Pec minor is a huge one. We got that thoracic outlet that goes underneath and through it, which is about here. It goes through the neck, underneath that clavicle, in through there and into the arm. Now, if anybody at home, if anybody noticed with your clients, these 3 fingers, maybe half of this one, these 3 fingers get numb or tingly, check the neck, check the pec, loosen those up, try to stimulate the opposite muscles. That's the thing you can do. You can either loosen up certain areas, or you can retension, like the soccer net, retension the areas that have lost its tension. Okay? Really cool, and I hope that you guys followed me on that one, because that information right there, if you address that on every part of the body and you really understand how that works, at home you can be your own therapist, which is the real concept of why I'm making this whole channel, so that I can help you guys, you people, get to a level where you can actually start being your own caregiver. You can think for yourself, treat for yourself. As long as you understand how the body is working, you can come up with your own treatment plans, but use your therapist as maybe as a guide or a movement, because all the people that I actually see get better are the ones that take their own health into their own hands. The ones that, anybody that depends on somebody for anything, you end up at the whim of their will, for example, and that's true for everything I've ever seen. That's neck pain. There is so much more to say about neck pain, a lot. However, I just want to still make this an introductory, even though I've been talking for hours. Let's say the next concept is low back pain. Okay. Low back pain, because I did talk about a lot of things, you understand certain concepts now. Now we're going to just take what I just said to you about the neck pain, and I'm going to use that and address that for low back, okay? Low back pain, general low back pain, right, is not usually an issue with the low back. I've heard this from Darby training systems. I've heard this from anatomy training systems. I've heard this from multiple teachers I've had. I've heard this from top-level chiropractors. General low back pain is a result of other structures acting on the low back, and then you feel it in your low back, and then that's where we tend to want to get treatments or therapy for our low back. Right, which is totally understandable. I had low back pain for years. Until I figured out what was happening, I kept dealing with it. I kept trying to stretch it. I did 8 to 10 years of yoga. I tried foam rolling. I tried everything. My low back, I just thought I had some issue. Maybe because I thought I kept cracking it like this when I was in high school. It just cracked right there. That was a big pop. I don't know if you heard that. But I used to do that chronically every single day, because I thought waking up, oh, I need to crack my back in order to feel good. Then it perpetuated itself, which is what